Well, that last PowerPoint about did me in. I'll probably do you in too, because it was really long. Transition to Parenthood. This is your chapter 22. And we're going to go through all the things that happen transitioning to parenthood. This is a fairly easy read, and you just have to kind of memorize the behaviors and what they mean and the names and everything that go with them. So basically I'm going to go over it, but you definitely are going to have to put in some memorization as to what attachment is, what bonding is, what acquaintance is. And attachment and bonding are two words that are used interchangeably. Attachment, of course, is the process in which the parent comes to love and accept the child. Now, you think that this is an automatic, awesome thing, that when the baby's born, the parents are going to be just really attached to that baby. Well, it doesn't always work that way. I've had experience with moms who come in, especially second-time moms. They say, I just don't feel the same way about my second baby as I did my first baby. And it's because the attachment process with the first child has developed as this child has gotten older and more attached to that child. And then when the second child is born, even though they're really attached to the baby, they feel a lot differently toward the first one. And it's going to take a while to get the attachment to grow into the same thing as what the child is. So basically, that's all attachment and bonding is when the parent comes to love and accept the child. Actually, the neonate. Sometimes babies are born, they don't look like what your ideal baby is. They have to grieve that baby, then they'll have to attach to that baby. So it's something that we want to see developing, and it's something that we can help develop by being sure the baby is available in the room with mom, and that when they're in close proximity, so that mom has that opportunity to be able to interact with the infant. So there's certain verbs and nouns and definitions that you have to know, such as mutuality. Mutuality is where the infant's actions are going to elicit a corresponding set of parental actions. If the baby looks like he's smiling, all the parents are going to just smile back and say, oh, look, he smiled. When they're that young, firstborn, they usually don't smile. It's just kind of a jerk reaction. But it is any action they do elicits a corresponding set of parental actions. If they cry, parents are going to go pick them up and soothe them. If they root, mom's going to feed them. So, that's what mutuality is. Infants whose temperament, social capabilities, appearance, and sex fits into what the parents expect will be able to attach better than those that do not meet that criteria. So if mom was expecting a blonde-haired, blue-eyed baby boy who's going to nurse well, poop and pee like he's supposed to and not puke, and lo and behold, when he's born, he's blonde, he's blue-eyed, he's a boy, he does all these things, it's going to be real easy for her and him to develop attachment and bonding. Whereas if that baby had been born bald-headed, female, cries all the time, doesn't fit that expectation the parents had, it's going to be a lot harder for those parents to actually attach to them, especially temperament. Baby's temperament really has an effect on bonding and attachment. Oops, what happened there? Well, here's you a blank screen. Let's just get rid of that blank screen. We don't need a blank screen. Delete that blank screen. Okay. And again, I forgot to put it in slideshow form. Ta-da! Miss Smedley brought me some summer sausage that they had made from a pig. Oh, so good. I know you'll want to know that so that you'll envision me munching down on summer sausage. Makes this, I can talk with my mouth full. Yeah, right. I don't think so. I'll try to be good and not munch on it, though, while I'm doing this, okay? If you hear me munching, just pretend I'm not, all right? Okay. Acquaintance. So what is acquaintance? When you're getting acquainted with someone, you do make eye contact, you talk to them. And with the babies, it involves touch and exploration. So, you're going to take you're going to touch the baby's cheeks, you're going to touch the little toes, you're going to make sure all the fingers are there, making eye contact with the baby. Even though the baby may not actually do eye-to-eye contact, babies are very attracted to their parent's face, and within so many inches they can see, about 20 inches they can actually see. Usually the distance between the breast and the mom's eyes, that's usually the distance they can actually see and make eye contact. So you have to be pretty close to an infant to make eye contact with the infant. Talking to the infant, tell them how sweet they are, how good they smell, and how much mommy loves them or how much daddy loves them. All this is acquaintance. Claiming process. He has my eyes. Oh, he looks like, when my son was born, I was like, he looks like your grandpa. Because I didn't want him to look like his grandpa. But my son had no hair. All he had is a little orange hue around his head. And of course, he didn't have any teeth. And Charles's grandpa was bald and no teeth. So I was like, he looks like your grandpa. But actually, he ended up looking a whole lot like Charles when it was all said and done. My husband, not the mailman, my husband. So it really worked out very well. I became very fond of my little red-headed boy. Although I didn't want a little redhead, I got a little red-headed boy, and he was definitely the light of my life and still is. And so is my daughter, and so are my grandkids, and so is all my family. But he was definitely unique. He was a late in life baby. All right. So we wanted the claiming process is how much does he look like me? How much does he look like you? What areas can I actually claim to make sure, say that this is part of my family? He has grandma's chin. He has that sixth finger on his hand, just like I had when I was a baby, and like my mom had when she was a baby. So that's claiming. Negative claiming is a bad thing. Mom or dad puts a blame on the baby. You caused me enough pain during labor, stop crying. So negative claiming. Nursing interventions is going to promote attachment. You can actually see on page 504 examples of parent-infant attachment interventions. So things that you can actually go through and help promote attachment, how we can help, are located there. So, make sure we give them the opportunity, encourage them to hold the baby really close, encourage them, of course, to give the bath, participate in all activities, changing the diaper. Dad changing the first dirty diaper is usually a big one. Making sure we're leaving the baby in the room with them, making sure we're providing all that stuff. So you can read all that stuff as you go down there. Of course, there are always your cultural considerations that you have to have. So it's not always congruent with the way we already talked about how some actual cultures do things a whole lot different than the American culture. And we cannot perceive that as not attaching or bonding. Chinese members lets and a lot of Hispanics let the other family members take care of the baby, and they don't do anything except rest and let mamas take care of them. Let their mamas take care of them. Some women won't initiate breastfeeding until they think their breast milk's come in. Eye culture, of course, we talked about how that how that's going to affect whether we think they're bonding or not. So be sure you know your culture of your patient. We want to be sure that we are documenting any of these emotional responses and bonding with the baby. Rooming in, of course, with liberal visitations with the siblings and the grandparents helps the attachment with the entire family. I've talked about how moms expect a fantasy baby. You carry this baby around and you expect it to look like a certain way, and then it comes out and it's totally opposite of what you expected. It's very hard to get rid of that fantasy baby. If you envisioned a beautiful black-haired, blue-eyed baby girl and you had a little bald baby red-headed boy, um, it would be a big adjustment. First, you grieve for the little girl that you didn't have, or the baby that was beautiful that you didn't have, and you have to attach yourself to the baby you do have, and you start finding features in that baby that will attach you to that baby. Well, he's got daddy's nose, he's got this. So you actually, it's a process that you have to make sure you're documenting. You have to be aware of this. So some of the things that's going to affect the process of attachment is if mom had a long labor. If she has a long labor, she's not going to immediately want to start attachment with that baby. She might want to hold him for a little bit, but then she'll probably want to rest. And she needs to rest because she can't recover if she doesn't rest. If she's taking medications, if she's having a breastfeeding problem, she perceives that the baby doesn't like her, doesn't like her breast, maybe doesn't want anything to do with her, and it has nothing whatsoever to do with that. It's all in how baby is trying to avoid having to work to get his milk out. He wants an instant gratification, and he's not liking the fact that he's having to work to get it. So it's, these are things that affect how attachment of the moms, because they don't feel like the baby's attaching to them. Parent-infant contact. We've talked about early contact. We do that mother-infant rooming in thing. Is really, really good. Right at birth, skin to skin. Even after birth, skin to skin is wonderful, especially for breastfeeding. It's going to improve their thermal regulation. So if you've got a baby that's not really, the temperature's running a little low, put them skin to skin with mom. That's going to actually improve their thermal regulation and their cardiorespiratory stability. Of course, if you have a really unstable baby, this is not the best thing to do. But we're talking normal, that maybe the heart rate's a little bit, a little fast, breathing's a little fast. You put the baby to chest, it calms him down to hear mom's heart rate and feel her skin next to his. All extended contact should be available, all of them, especially those that have problems, such as adolescents and low-income women. Things that we need to do for that is to, make sure the baby's in the room, make sure that we are encouraging the teenager or the woman to have hold the baby by saying, the baby's really awake right now. Wouldn't you like to hold the baby? Or somehow be able to try to get them involved in taking care of the baby so that they actually can transition in with the baby. So we do like to do extended contact with those. So be sure that we are especially aware of our adolescents and our low-income mothers on how they are actually bonding with the baby. Sometimes you have drug-addicted parents that don't, they won't attach to the baby because they know the baby's going to be taken away from them. Then you've got drug-addicted parents that really attach to the baby and don't want to let the baby go when DHS comes in. So it's kind of a no-win situation. So how do we communicate to our infant, and how does the infant communicate back to us? Well, touch is extremely important to the parents, to touch the baby and feel that baby's soft little skin. There is not a human in this world that picks up a baby that doesn't actually feel the cheeks, feel of some part of the baby, pat the baby's butt. We always want to touch the baby. So fingertips is usually something where we start at doing the fingertip thing and moving it over the baby and touching them. And then we, after we do the fingertips, then we start enfolding them in our arms. Infants will actually pat at the breast when they're breastfeeding. Kind of reminds me of puppies or cats when you watch them breastfeeding. They massage the breast to get the milk to come out. It seems like the babies are trying to do the same thing to me. It's really cute. Again, be sure you're watching out for cultural practices. The Vietnamese parents don't even want to touch or make eye contact in order to ward off evil spirits, which brings us to eye contact. Usually when the baby's really alert, it reinforces trust, the development of trust versus mistrust. Well, this helps us develop trust in North America, but in Asian and Hispanic cultures, this is not necessarily the case. So there are some cultures that avoid contact because of the possibility of the evil eye thing. Babies always recognize mom's and daddy's voices and possibly siblings if the babies have talked to them in utero. They really like the high-pitched tones. That's why they recognize mom's voice. And when they hear mom's voice, which is a female high-pitched tone, they like that because they're used to hearing that. And it actually alerts them. If you want to calm the baby down and mom's trying to do it and it's not calming down, dad may be able to do it better than mom because he has a low voice and it kind of lulls them to sleep. They recognize odors. Moms love to smell their babies at birth, and actually babies can actually smell mom's milk, and they can actually tell mom's milk just by the smell from another woman's milk. Entrainment. This is when they move in time with structure of adult speech. You know, when you're talking to them, they'll wave their arms, they'll kick, they'll dance to the parent's speech pattern. Biorhythmicity is when the baby is being in tune with the mother's natural rhythm. So mom's heartbeat will soothe them. And basically that's, they have to establish their own personal biorhythm. And moms help out with them doing this by giving consistent care and making sure that, you know, when they're alert, they're talking to them and developing responsive behaviors. So they're actually working on the biorhythms there. Reciprocity, when the body movements or behaviors that provides caregivers with clues. You know, like it takes it several weeks for them to develop, but they figure out when they cry, mom will pick them up. They figure out when they root, mama will feed them. And they figure out that there's certain things that if they smile and giggle, mom will talk to them. So it takes them several weeks to develop it, and they continue to develop that as they get older. Synchrony is just a fit between those clues and parental response. Mom's actually going to learn that there are specific cries that need specific things, that the baby has specific needs that they need to have met. All right, so the transition to parenthood basically is a time of disorder and disequilibrium. We all kind of feel a little bit chaotic trying to incorporate a new life into our life. Make sure the siblings are acceptance. We all have to use a transition period. And most of us hate change, but we try to work around it. You know, I may have to give up my Thursday night, whatever I do on Thursday night, which is usually work. But if you had to give up something because you had a baby and the baby requires certain times of your day and you can't do things, you know, that's a disruption and a transition. Men tend to feel more deprived because the baby gets all the attention. Mom has to take care of the baby. Mom has to give the baby all the attention the baby needs. And so dad's not getting as much attention as he used to. Siblings are the same way. They're not getting the same amount of attention they did before the baby walked into the world. Babies have to be fed, changed, fed and changed, fed and changed, fed and changed, played with, fed and changed. So that really makes a lot of difference. So parenthood is stated that it's an opportunity and not a time of danger. This isn't always true because there can be, when men feel deprived, this could become a time of abuse in this area. The baby can be in danger from shaken baby syndrome if the parents are not able to deal with a baby who has a terrible temperament. So it's not always true that you're going to be able a time of danger, because there is danger there, and there's also danger of the baby not developing and possibly having SIDS. So they, you know, and they feel deprived. So you really have to make sure that they know what can constitute a danger sign. Parents have certain tasks that they have to do. They have to reconcile that fantasy child with what they really got, the appearance, the sex, the temperament. Don't be criticizing your parents if they're not transitioning into this role well. They just need you to support them and praise them for what they do and not what they don't do. So becoming a mother is, we've talked about, you aware during pregnancy you have to go through that phase of I'm going to be a mother. Well, here is you are a mother, so you have to go through all the little phases of becoming a mother. And usually with the maternal role is in 3 phases: the taking in phase, the taking hold phase, and the letting go phase. The primary process, of course, is engagement and commitment, and the secondary process is being able to experience herself as being a mother. So some women have a lot of losses when they become a mother. They lose their family support. Maybe the dad decides he don't want to be a dad and he's out of there. So they do have some losses that we have to be sure that we're looking at. So the taking in phase is when, mom's just kind of focusing on herself and meeting her needs. The taking hold phase during that postpartum period is that she will actually start taking over and becoming semi-independent by taking care of the baby, has that desire to be in charge. And then that letting go phase is where she's going to be able to be interdependent, to where she can reassert her relationship with her partners and so forth. So these are some things that she has to do when she's becoming a mother. They have maternal sensitivity. Maternal responsiveness is an important determinant of maternal-infant relationship. And those are some just different things that you have to help mom learn to be a mom and accept to be a mom. And she has to go through those phases. If she's in that phase of taking in, she is not going to be very responsive to taking hold, being able to take care of the baby. And those phases last for several hours or so right after birth sometimes. Hopefully not more than 12 hours, because then it's a problem. Postpartum blues. 50 to 80% of women experience postpartum blues. Postpartum blues is just kind of like, well, it's anticlimax. I've been pregnant for 9 months, been anticipating this birth for 9 months. After several hours of labor, kaput, here I am. I've got the baby. Everybody's come to see the baby. Nobody's come to see me. My hormones are changing. I'm not pregnant anymore. I'm missing that fetus moving around inside me. I've got this baby that I've got responsibilities for. So, the hormones especially are what's going to cause them to cry easily for no reason. If you brought them an ice water and they didn't want but 2 cubes of ice in it, and you brought them a whole glass full of ice and a little bit of water, they might cry over that. It's really not very important, but to them it was like, hey, you didn't care about me enough to do that. And it's because all these things are just resolving at the same time. So she mourns the loss of who she was. She's really going to miss that fetal maternal relationship. She can't put her hand on her belly and feel the baby move. Yes, she's got the baby right there she's looking at, but there's a different relationship. It has changed, and it's just like any other changing relationship. She's going to be fatigued. And those all come together to make them have postpartum blues. They kind of lose interest in themselves. But this should only last a few days. If it lasts for more than a couple of weeks, you're looking at it developing into postpartum depression. And that can definitely be devastating in its effects, especially with how the mom and the baby are actually able to coincide with each other. We now have some teaching for self-management for postpartum blues. It's on page 509. Got to remember to tell them that this is normal and the parents should expect that it's going to happen. They should get a lot of rest. They should take time for themselves, go on a date with themselves, or go without the baby, or take the baby somewhere. All these things, we want to make sure that we are um, taking care of mom through these postpartum blues, because we certainly don't want them to become postpartum um, depression. So how about the dad? He goes through much the same thing as the mom does. He goes through some phases of expectations, confronting reality, creating the role, and reaping the rewards. Those are things that are his phases that he goes through. He really has more social time with the baby than the care time that mom gives with the baby. So you're going to see that happening. That mom's going to feel like, well, dad always gets to do the fun stuff and I have to do all the work stuff. But anymore these days, a lot of fathers are jumping in there and taking responsibility. So it really helps a whole lot um, when dads are encouraged to participate in the baby's care, not just encouraged to please here, play with the baby for a while I get supper ready. It's really a big thing. So your book goes through those 3 stages that that dad goes through. That first 4 to 10 weeks, he's uncertain, he's got increased responsibility, can't sleep, has no control. And then he goes on into finally getting into the second phase, where he's confronting the reality that his expectations were inconsistent with his uh, realities of life. And then the third part is where he's going to be working pretty hard to create that role of the involved father. So, um, first they think they're going to be perfect dads, and they have that reality check, and then they got to accept that the reality that expectations were inconsistent. Sometimes they're jealous of the infant and mother relationship, and so mom should strive to include dad in all aspects of care. Fathers do become completely engrossed by the infant, and of course it's called engrossment. So the father just is intensely involved with the babies. In the Northern American culture that we have, they have a powerful effect on babies. Babies have a powerful effect on the daddies, and dads feel a really strong attraction to the newborn. So that is known as engrossment. And then, of course, the whole couple relationship has to change. If they have a really good marriage and a strong relationship, it's going to make for good partnerships. Never have a baby to save your marriage. Doesn't ever work. Too much work puts too much strain on an already strained relationship. It's not going to get better. It's going to get worse. Your relationships with one another is going to change. Mom, of course, spends more time with the infant. Sometimes the household chores has to be taken over by dad because mom's so busy taking care of infant, especially if she's breastfeeding, because breastfeeding is going to just absolutely encompass her for the first few weeks until that baby actually manages to establish a milk supply. If she's working, she has to balance work with home, and dad has to balance work with home. So sometimes spending time together without the baby is going to help ease some of that tension that develops. Um, so it's always good to have a date night. Then sexual intimacy is something that they usually start to resume between the second and fourth week of postpartum, like we talked, when the bleeding stops and the episiotomy heals. We've already talked about these things. It should be up to the woman to actually initiate sexual return to the sexual intimacy, because of how her body works, and she knows how it actually feels. Then we have infant parent adjustment. We have a lot of definition here: modulation of rhythm, modification of behavioral repertoires, mutual responsivity. These are all things that we're looking at. The rhythm is when the baby and the parent are interacting in that alert state. On face is the most desired position to be able to establish this. That is face to face, where the baby's face and dad's face are looking at each other. The behavioral is where both parties use methods, such as the baby gazes, maybe bobbles or makes noises or cries, has facial expressions, body gestures that's going to cause mom to have a returning, mom and dad to have a returning behavior back, such as smiling, talking, whatever the baby needs. And of course, responsivity is when a specific time, it occurs within a specific time to a stimulated behavior, such as when a parent talks to the infant's going to smile back. So that's responsive. Baby responds to whatever, to what mom or dad says to the baby. So we do have some diversity in our transition to parenthood. Age makes a whole lot of difference in that. So our adolescent mother is going through a whole lot. She's still in developmental stages herself. She is in egocentricity and concrete thinking, and she is not able to always transition into that parenting role very well. Some teenagers do really good. Some teenagers have a lot of difficulty because they are giving up a lot of their teenage life when they should be carefree and not have to worry about being a parent. So it's really difficult for some of them to accept that changing role. They're going to feel a lot different than their peers. Your 14-year-old daughter that got pregnant and had a baby that used to go spend the night with her girlfriends and talk about boys and play dolls and put on makeup, she's not going to be able to do that anymore. She's going to feel isolated from them. She's going to feel excluded because now she has her own baby. She doesn't, and she has to account for taking care of that baby. They don't use as much verbal interactions with the infants. They have a tendency not to talk to them, and they're less responsive to infants' clues. And they usually expect too much too soon from the babies. They expect them to be more in a, like when it comes to laughing or being able to sit or start to crawl, they expect it to happen too soon. And of course, the adolescent father still has some of the same challenges of the unmet developmental stages. Um, they are pressured from both the mother's parents and their parents to help provide for the child. And of course, he may only be 14 years old too, and so he can't go out and get a job. So whose responsibility does that lie on to provide for the family? Is going to rely on his family. He may or may not have wanted to become a dad. It might have been the first time he ever had sex, first time she ever had sex, and whoop, she became pregnant and decided to have the baby and decided to keep it, which she may have been pressured to by her parents or whatever the decision might have been. Dad is kind of a reluctant participant in all of these things. So dads need a lot of support and education, especially these adolescent dads. Then we have our maternal age over 35. This we're seeing happening a lot because a lot of women are putting off their birthing and start having their family because they have careers. They don't just have a job. A lot of us in nursing, a lot of us are in administrative positions. We are in big businesses, and we just delayed having our family. Sometimes it's infertility, and or they want to continue having babies even in their late 30s. So a lot of these, any of these things would be the reason why they would have babies over the age of 35. So she's older than a lot of the peers that has the same age, feels a little outcast. I remember taking John to Walmart when he was that's my son, probably 3 months old, and everybody asked me if it was my grandson. So, I felt rather put out by that, embarrassed. It's like, you're too old to have they were putting a stigma on me that was too old to have a child, basically a baby. So, and they automatically assumed that it was my grandson. I was 35 when he was born, and that was my grandson. So, it was really kind of, it bothered me. I felt kind of outcast, especially when we would go to functions and hear poor little John really proud his mom came, and I'm looking at all these young mothers, and they're kind of looking at me, and um, we just weren't fitting in together. Uh, you feel a loss of control over your life. After 35, you've established a career, you've established a job, and all of a sudden you got a baby. What are you going to do? Um, Dad's not usually as affected as much as mom is. She worries about, is she too old to have a baby? Is her body going to be able to have this baby? How's she going to handle having a baby and handle her career and everything like this? I got pregnant with John when I was in RN school, and it was devastating to try to, I was at a loss of control. Here I am in school. I want to get my RN degree. I did want to have my baby, but you had wanted to have it earlier than this, and this was kind of like, well, I didn't start taking my birth control again soon enough, whatever. And so I felt like a loss of control. So I can understand how she would feel. Dads are more patient. They love their babies. My husband was very excited when he found out that our little John was on his way. And he took it much better than I did. Then we have our lesbian same-sex couples. So, it's unique in that there's two women or two fathers raising a child. Now, the two women can have artificial insemination. They can actually go out and have an affair and get pregnant by someone, have someone donate sperm, use a turkey baster. There's all kinds of ways they can get pregnant. They can both get pregnant, or one can get pregnant, and one is more of the father figure, one is more of the mother figure. They can both breastfeed. Um, and it's really difficult for them because they have to face others and the others' opinions. We are very opinionated in that we think that a family unit should be a father, a mother, and the children. We don't think it should be two mothers and a child. But why is it okay to accept a single parent and a child? It's okay if a poor old single mom has to try to raise three children on her own, but it's not okay for two mothers to raise three children because they are um, having a relationship that society doesn't approve of, and this is somehow going to affect how the child is going to grow up and who he's going to turn out to be. So they face a lot of controversy in there, and same-sex fathers, same way. Same-sex, the mothers, both of them can breastfeed if they want to. One can do it naturally, the one that gave birth, and the other one can actually do so with artificial tubing. So there's a lot of sanctions that have to be faced about when same-sex couples decide to actually have children. And there are some states that won't allow adoption for same-sex male partners. So it's really a difficult decision for them to do. Then we have, of course, social support. And this is always very important when related to positive adaptation. If we don't have our family and friends supporting us, we feel totally lost. If our parents and the rest of our friends aren't just happy for us, and they're like, you shouldn't have got pregnant at such an old age, or you shouldn't have got pregnant as a teenager, this is going to make us feel really bad and resent our pregnancy and resent our life. And, we're already mentally challenged because of all of our hormones. So this is really a big deal with social support. A lot of cultures provide more support for their new mothers than Americans do. They place an importance on desiring and valuing children, whereas a lot of American cultures are not as supportive for the new mothers. In a Hispanic culture, the maternal grandmother will be in there waiting hand and foot on the new mother and on the baby, and making sure that mom is mothered as well as the baby is. But in America, it's like, get up and do it yourself. We're independent. We are here. We are woman. Here's roar. Rah, rah, rah. Well, we're gonna roar all right because we'll be complaining about all the things that we're having to do because we don't value being taken care of by others. The influences influence interactions between the parent and the health givers make a lot of difference. So be sure you know those cultural differences so that we know what's best to do for our patients. Socioeconomics has a big impact on parenting. Are we do we have access to all available resources? And usually each child you have, it drains your finances a little more. Instead of two pairs of shoes that you were paying $200 for each pair, you now have 3 pairs of shoes you're paying $200 each pair for. So finances do get strained when you add additional children. Um, your personal aspirations. It may interfere with some of your plans for the future. Oh, I got pregnant. I can't finish nursing school. Well, I did anyway. I didn't think I'd live through it, but I did. And you guys that are pregnant will live through it too, but you're going to think you won't, especially when the baby comes and your brain is thinking, I don't want to think about this, but you will. You will be fine. I did it. You can do it. But there are a lot of times that, it does interfere with that. Unresolved resentment is going to affect caregiving. If I resent that baby because it came at a bad time, caregiving is going to be bad. And the nurses need to realize that these parents need to express their feelings and try to work around them. Sensory impairment. What if we have a parent who are visually impaired or hearing impaired? I had a mother-father couplet come in to have their baby, and neither one of them could hear. They were both deaf. And so our conversation, of course, was carried on. I didn't know sign language. Miss Candler knows sign language. She probably would have been a wonderful nurse for them. But we actually communicated through the written word and through body language. So, did I worry about them being able to take care of their child when they got home? Neither one of them would be able to hear the baby cry. Neither one of them would hear the baby choke. Neither one of them would know when that baby was in distress. So things like flashing lights, vocal recordings to help the infant identify with voice recognition. So, they can't, if they're not able to talk, and usually they're not, if they can't hear, they can't talk, and if they can talk, they don't speak with a dialect that's actually considered a normal dialect. So you can actually play back recordings of someone reading a book to them so that they can actually develop speech. Visually impaired parents can't ever do that eye contact that's necessary, but others can do it for them. It doesn't necessarily have to be eye contact with mother. Attachment can still occur. It's just one of those things that's you're going to bypass and you're going to emphasize others. So we need to make sure that we're assessing the needs of each one of these particular types of sensory impairment and be aware that yes, people with sensory impairment, hearing, visual, they actually can have children and have a good family relationship and raise wonderful children. I had a young lady who was a paraplegic that had a baby. And I was like, how in the world is she going to take care of this baby? Well, she had some adaptive equipment that she could attach to her upper body that she could use to help her move her arms and hold the baby and change a diaper and feed the baby. It was just amazing. So, she was a paraplegic, not by choice, but she managed to go ahead and have a beautiful, normal baby, and she was able to take care of it. And I thought that was just really awesome that she was able to do that. So, don't look at people and be so judgmental. Siblings can drive you crazy. The new baby, they will either love it or they will hate it. They will do mean things to it or they will be nice to it, or they will do both. One day they may wake up and just really not like that baby at all and be mean to it, or they may be very good to it. So it's really however that how your children accept the new baby. They all have to assume new positions. If you're the middle child, or if you're the second child and you're not the middle child, as soon as the third child's born, you become the middle child. So, there's all kinds of studies on being a middle child. I was the baby, and you can tell. Um, In fact, my brother, that I consider the middle child, I was just speaking to him a few weeks ago, and my mother had a fetal loss, or stillborn, and then she had my oldest brother, and then what I consider my middle brother, and then myself. And he was said several times, "I'm not the middle child. I am my mother's third child. I am not the second child. I'm not the middle child. I am one of four." So he really had some middle child issues. He did not want to be considered the middle child. Um, so, of course, me not being a middle child, I have no idea how he feels. But evidently, it must be a little bit hard to deal with. If you have an infant that has special needs, breastfeeding the baby, if the baby has to have certain things done because it has a certain defects or anything, complications are definitely can arise with sibling rivalry. Um, Once the baby's newness wears off, you start seeing it develop. Usually, when they're first born, I have had little brothers and sisters, and that baby's born. They were like, "Take it back, I don't want it." To the "Oh, I'm ready to take it home with me. Let me have it. I'm not giving it to anybody else." By letting the siblings assist in the care, that helps. But then the siblings aren't going to want to take care of the baby when you want them to take care of the baby later on when they get older. They resent that. So you got to be really careful about how you do that. Our grandparents, most of them are really excited about having grandbabies, unless, of course, they are the ones that are, okay, this is your fourth baby, so this is the fourth baby I'm going to have to adopt and raise, and I'm getting too old to raise four children. So, depends on the situation. You start seeing the transition of roles. Grandparents don't have to be so strict. They can spoil the kids rotten. Um, they can help their children become parents. Um, and they, of course, are doing that life transition themselves, hopefully, to downsizing, empty nest, and retirement. There are cultural differences between grandparents' roles. Um, Sometimes relationships between the grandparents and the parents change. Most of my children do not want me to tell them how to raise their children. So it's really hard not to be interfering and yet offer to be helpful. Yay! We got to the end. Aren't y'all proud? I know I'm proud.